Hello everybody, I'm Dr. Raghavendra, Lead Consultant, Pain Palliation and Rehabilitation Services, Aster Hospitals, Bangalore. The topic we're going to discuss about is pancreatitis and what interventional pain management could offer. Now, we understand chronic pancreatitis patient would have undergone the series of whatever tests, management plans, treatment options which have been suggested by the gastroenterologist, and still they could actually have persistent or intractable pain to all forms of conservative management. For these group of patients, the only interventional pain management could offer is celiac plexus block. In older terms, we used to use alcohol ablation for celiac, but now as the technology has advanced, we are talking something which is related to radiofrequency ablation of the splanchnic nerves, which cannot be done on celiac plexus. Over here, celiac plexus is an outdated intervention for chronic pancreatitis patient. So here the greater, lesser and least splanchnic nerves form the celiac plexus. So ablating the splanchnic nerves is going to be much more better, easier, would lead to better results in these group of individuals. So we would place two needles at the level of D10 and D11 on the paravertebral space, both the sides, left side as well as the right, and then radiofrequency, that is conventional radiofrequency ablation, would be done after stimulating and checking the patient for the similar type of pain they are experiencing. Now, usually the pain which they would actually experience is abdominal pain, which is actually getting referred to the back. Severe could be with any form of oral intake of fluids or food, or when they are actually hungry also they could feel. So these are certain aspects which needs to be examined before. Appropriate investigations have to be done, and anesthesia wise to be checked for monitored anesthesia care during this procedure. They would be sedated, henceforth the pain procedure would be as minimal pain as possible. So this procedure is done on a daycare basis. They get admitted in the morning. The procedure would be undergone about an hour's time, and then they would be shifted to the recovery. In the recovery, we would check for the next 2 to 3 hours for the recovery from the sedation. Once they have recovered, they would be started on oral fluids and food later on and discharged the same day. Most of these patients recover from these intractable episodes of severe abdominal pain which is shooting to the back largely by 70 to 80%, and it would continue for a persistent about 2 to 3 years plus of reduced pain on minimal medications. This is a good way of actually handling only group of patients with intractable abdominal pain because of chronic pancreatitis.